Question 1. In a context of cardiac interventional radiography, a 65-year-old patient, Mr. Thompson, has been scheduled for a coronary angiography procedure. During the procedure, the medical team discovers that Mr. Thompson has a known allergy to iodine contrast. What is the most appropriate course of action for the radiologic technologist to take in this situation? A. Proceed with the procedure without using contrast media to avoid any potential allergic reactions. B. Administer a pre-procedure antihistamine to counteract any allergic reaction. C. Inform the physician immediately, prepare for potential emergency interventions, and document the allergy in the patient's chart. D. Contact the patient's primary care physician for guidance and delay the procedure until further instructions are provided. Answer. Correct answer. C. Inform the physician immediately, prepare for potential emergency interventions, and document the allergy in the patient's chart. Explanation. According to the ARRT guidelines on patient safety, when known contrast allergy is identified, it is crucial to immediately inform the physician, as they will need to make decisions regarding alternative contrast agents or medications to prevent an adverse reaction. The radiologic technologist must also ensure that all appropriate safety measures are in place, such as access to emergency medications and protocols for managing allergic reactions. It is essential to document this allergy in the patient's chart to ensure future safety and avoid repeated exposure to potentially harmful substances. Question 2. Given the circumstances, Mr. Ramirez, a 55-year-old patient, is undergoing a percutaneous coronary intervention (ECA) procedure. During the procedure, the physician utilizes a balloon catheter to open a narrowed coronary artery. What is the primary concern for the radiologic technologist in terms of patient safety during this procedure? A. Ensuring that the patient remains still to prevent motion artifacts on the images. B. Monitoring the patient's heart rate and blood pressure to detect any hemodynamic instability. C. Verifying the patient's contrast allergy before administering contrast media. D. Managing the patient's emotional state by providing reassurance and reducing anxiety. Answer. Correct answer. B. Monitoring the patient's heart rate and blood pressure to detect any hemodynamic instability. Explanation. During PCI, one of the primary concerns is ensuring that the patient's cardiovascular status remains stable, particularly in terms of heart rate and blood pressure, as balloon catheters can induce changes in hemodynamics, such as hypotension or arrhythmias. Continuous monitoring is necessary to detect any signs of instability. This is critical for patient safety, as these changes can indicate complications such as vessel perforation or arrhythmic events that require immediate intervention. Question 3. While examining the patient's medical history, Mrs. Jenkins, a 72-year-old patient, reports she is on several medications, including anticoagulants. What is the most important factor for the radiologic technologist to consider when preparing for her coronary angiography procedure? A. Discontinuing anticoagulant medications a few hours before the procedure. B. Ensuring the procedure is performed with a low dose of contrast media. C. Confirming that the patient has no other underlying conditions, such as diabetes or hypertension. D. Coordinating with the physician to determine if additional precautions are necessary due to anticoagulant use. Answer. Correct answer. D. Coordinating with the physician to determine if additional precautions are necessary due to anticoagulant use. Explanation. Anticoagulant medications can significantly increase the risk of bleeding, especially during invasive procedures like coronary angiography. It is essential to collaborate with the physician to determine whether the anticoagulant therapy should be adjusted or temporarily halted before the procedure, depending on the type anticoagulant and the specific patient situation. Additional measures, such as close monitoring of coagulation parameters, may be required to minimize the risk of bleeding complications. Question 4. Based on the information available, a 60-year-old patient, Mr. Green, is undergoing a cardiac catheterization procedure. The physician has ordered a contrast agent to visualize the coronary arteries. What is the most appropriate step to ensure patient safety during contrast administration? A. Administer the contrast media as quickly as possible to minimize procedure time. B. Confirm that the patient has not eaten or drunk anything for at least 12 hours before the procedure. C. Verify that the patient's kidney function is normal before administering the contrast agent. D. Instruct the patient to remain perfectly still throughout the procedure to avoid contrast media displacement. Answer. Correct answer. C. Verify that the patient's kidney function is normal before administering the contrast agent. Explanation. Before administering contrast media, it is crucial to assess kidney function, as impaired renal function increases the risk of contrast-induced nephropathy (SIN). According to ARRT clinical guidelines, checking serum creatinine levels or glomerular filtration rate (GFR) is important to identify patients at risk (SIN). Ensuring normal kidney function helps mitigate this potential complication and ensures safe administration of contrast. Question 5. To what extent does the use of digital subtraction angiography (DSA) improve the accuracy of coronary artery imaging during cardiac interventional procedures? A. It significantly reduces radiation exposure to both the patient and healthcare staff. B. It enhances the visualization of blood vessels by eliminating background anatomy, thus improving diagnostic accuracy. C. It allows for faster acquisition of images, reducing procedure times. D. It has minimal effect on the clarity of images compared to traditional angiography. Answer. Correct answer. B. It enhances the visualization of blood vessels by eliminating background anatomy, thus improving diagnostic accuracy. Explanation. Digital subtraction angiography (DSA) is a technique that significantly enhances the quality of coronary angiograms by digitally subtracting background anatomy and highlighting blood vessels. This results in clearer, more detailed images which improve diagnostic accuracy and help identify coronary blockages or other abnormalities. DSA's ability to improve visualization makes it a key tool in interventional radiology, particularly in complex cases. Question 6. What would happen if a patient undergoing cardiac intervention experiences an allergic reaction to the contrast media during the procedure? A. The procedure should continue as planned, and the allergic reaction will subside on its own. B. The healthcare team should immediately administer antihistamines and continue with the procedure. C. The procedure should be paused and emergency protocols should be followed to manage the allergic reaction. D. The patient should be sedated to reduce anxiety and wait for the reaction to subside. Answer. Correct answer. C. The procedure should be paused and emergency protocols should be followed to manage the allergic reaction. Explanation. In the event of an allergic reaction during a cardiac interventional procedure, immediate action must be taken. The procedure should be paused and emergency protocols, including the administration of epinephrine or other medications, should be followed to manage the reaction. The healthcare team should be prepared to handle allergic responses, such as anaphylaxis, which can lead to respiratory distress or shock. Adhering to established emergency protocols ensures patient safety and effective management of the reaction. Question 7. When considering the use of intra-aortic balloon pumps ARRT during a cardiac procedure, what is the primary function of this device? A. To monitor the patient's heart rate and rhythm in real time during the procedure. B. To provide mechanical circulatory support by increasing coronary perfusion and reducing afterload. C. To administer contrast media directly to the coronary arteries. D. To maintain normal blood pressure by regulating fluid levels in the arteries. Answer. Correct answer. B. To provide mechanical circulatory support by increasing coronary perfusion and reducing afterload. Explanation. The primary function of an intra-aortic balloon pump ARRT is to provide mechanical circulatory support to patients with cardiac dysfunction, such as those undergoing cardiac interventional procedures. The ARRT increases coronary perfusion by inflating during diastole and reduces afterload by deflating systole. This helps the heart pump more efficiently, improving oxygen delivery to the myocardium, and is particularly beneficial in patients with low cardiac output or those at risk of cardiac arrest. Question 8. Mr. Foster, a 68-year-old patient, is being monitored during a coronary angiogram. What is the primary responsibility of the radiologic technologist in ensuring that radiation safety protocols are followed during the procedure? A. Ensuring that the patient is adequately shielded to minimize radiation exposure. B. Reducing the amount of contrast used to minimize patient exposure. C. Performing regular radiation safety surveys and documenting the results. D. Managing the radiation dose delivered to the patient and healthcare staff. Answer. Correct answer. D. Managing the radiation dose delivered to the patient and healthcare staff. Explanation: radiation safety is a critical aspect of any interventional radiology procedure. The radiologic technologist is responsible for managing the radiation dose to minimize exposure to both the patient and healthcare staff. This involves using the lowest possible radiation dose necessary to obtain high-quality images, utilizing techniques and monitoring radiation levels throughout the procedure to ensure adherence to safety guidelines such as those outlined by the ARRT, as low as reasonably achievable principle. Question 9. Considering the evidence, a patient undergoing a coronary angiography procedure reports experiencing pain at the vascular access site after the procedure. What is the first step the radiologic technologist should take in managing this patient? A. Provide analgesics and proceed with routine post-procedure care. B. Perform a thorough assessment of the access site and notify the physician of any unusual findings. C. Reassure the patient that the pain is normal and will subside within a few hours. D. Monitor the patient's vital signs and wait for the pain to subside naturally. Answer. Correct answer. B. Perform a thorough assessment of the access site and notify the physician of any unusual findings. Explanation: after a coronary angiography, the patient may experience discomfort at the vascular access site. However, if the pain is severe or accompanied by other signs of complications such as swelling, bleeding, or hematoma, it is crucial to perform a thorough assessment of the site. Any abnormal findings should be reported to the physician immediately to prevent further complications such as hematoma formation, infection, or arterial dissection. Question 10. In light of recent developments, what is the most significant concern when using fluoroscopy during cardiac interventional procedures? A. Ensuring that the fluoroscopic unit is calibrated to produce the highest possible image quality. B. Minimizing the radiation dose to the patient and healthcare staff while maintaining diagnostic image quality. C. Using fluoroscopy only when necessary to reduce the duration of the procedure. D. Increasing the radiation dose to expedite the procedure and minimize patient discomfort. Answer. Correct answer. B. Minimizing the radiation dose to the patient and healthcare staff while maintaining diagnostic image quality. Explanation: the primary concern with using fluoroscopy during interventional procedures is to minimize radiation exposure to both the patient and the healthcare staff while ensuring the necessary image quality for accurate diagnosis and treatment. This is consistent with the ARRT principle, which emphasizes using the possible radiation dose that still provides adequate imaging for procedural success. Techniques such as pulsed fluoroscopy and shielding are employed to achieve this goal. Question 11. In the context of administering contrast media during a cardiac catheterization procedure, a 58-year-old male patient has a known allergy to iodine-based contrast agents. He is about to undergo a diagnostic coronary angiography. What steps should the healthcare team take to ensure patient safety and minimize potential allergic reactions? A. Administer a pre-procedure antihistamine and corticosteroid to prevent an allergic reaction. B. Use a non-iodine-based contrast medium such as carbon dioxide or gadolinium. C. Proceed with the iodine-based contrast media, as allergies to contrast media are not clinically significant. D. Delay the procedure and refer the patient for pre-procedure desensitization therapy. Answer. Correct answer. B. Explanation: in this scenario, the patient has a known allergy to iodine-based contrast agents, which poses a risk of an allergic reaction. The correct course of action would be to use a non-iodine-based contrast medium such as carbon dioxide or gadolinium to prevent an allergic reaction. Option A is not always effective in preventing reactions to contrast media, and option C is contraindicated due to the known allergy. Option D is not necessary if an alternative contrast agent can be used. Question 12. Considering the principles of patient privacy and confidentiality, a healthcare provider inadvertently discloses patient information to a third party without consent during a routine cardiac interventional procedure. What is the most appropriate response according to HIPAA regulations? A. The healthcare provider should immediately inform the patient and document the breach in the patient's medical record. B. The healthcare provider should ignore the disclosure as it was minor mistake and does not affect the patient's care. C. The healthcare provider should report the breach to the hospital's privacy officer and cooperate with any investigation. D. The healthcare provider should attempt to retrieve the disclosed information and delete any copies that were shared. Answer. Correct answer, C. Explanation. Under HIPAA, Health Insurance Portability and Accountability Act, any unauthorized disclosure of protected health information, FI, must be reported to the privacy officer. The healthcare provider must fully cooperate with the investigation to ensure compliance with confidentiality regulations and mitigate any damage caused by the breach. Option A is incomplete as the disclosure should be reported, not just documented in the patient's record. Option B is incorrect as it neglects the need to address the violation. Option D is not an appropriate response as the breach must be reported, not simply erased. Question 13. During a coronary angioplasty, Mr. Smith experiences an unexpected decrease in his blood pressure. The interventional radiography team notices that the patient's echo shows signs of bradycardia. What should the healthcare provider's immediate priority be? A. Administer vasoactive drug to raise the blood pressure and monitor the patient closely. B. Initiate cardiopulmonary resuscitation (CPR) and prepare for possible intubation. C. Monitor the patient's vitals while continuing the procedure as these signs are common in cardiac interventions. D. Stop the procedure immediately, remove all equipment, and transport the patient to the emergency room. Answer. Correct answer, A. Explanation. In this situation, the patient is experiencing hypotension and bradycardia, which are potentially life-threatening conditions. The priority should be to administer a vasoactive drug to raise the blood pressure and manage the bradycardia while continuing to monitor the patient closely. The healthcare team should also be prepared to initiate CPR if the patient's condition worsens, but immediate administration of vaso medication is the correct response. Option B is too drastic, unless the patient enters cardiac arrest. Option C is incorrect because it does not address the immediate concern of hypotension. Option D could be an overreaction, unless the patient is deteriorating rapidly. Question 14. From the perspective of infection control during a cardiac catheterization procedure, which of the following is the most critical practice to prevent the transmission of infection? A. Using sterile gloves and draping during the procedure, ensuring that all sterile fields are maintained. B. Administering prophylactic antibiotics to all patients before the procedure to prevent infections. C. Ensuring that the angiography suite is disinfected at the end of every procedure, regardless of whether there is visible contamination. D. Reusing catheters and wires if they appear to be intact after a previous procedure. Answer. Correct answer, A. Explanation. Infection control during invasive procedures such as cardiac catheterization requires strict adherence to sterile techniques. This includes the use of sterile gloves, draping, and ensuring that sterile fields are maintained throughout the procedure, while prophylactic antibiotics, option B, may be appropriate for some patients. Maintaining sterility is the most critical factor in preventing infection during the procedure. Option C is good practice but does not directly address the procedure itself. Option D is a clear violation of infection control standards, as catheters and wires should never be reused unless specifically designed for multiple uses with proper sterilization. Question 15. Upon closer examination of a patient's medical records, the healthcare team realizes that the patient has a pacemaker. What is the most important consideration before proceeding with a cardiac interventional radiography procedure? A. The pacemaker must be disabled or reprogrammed to avoid interference with fluoroscopy. B. A thorough review of the patient's anticoagulant therapy should be done to adjust medication levels. C. The patient must undergo 12-lead IC to assess pacemaker function before the procedure. D. The interventional radiologist should consult with the patient's cardiologist to determine if the procedure is safe to perform. Answer. Correct answer, D. Explanation. Patients with pacemakers require special consideration during cardiac interventions due to potential interference with devices or lead dislodgement. Consulting with the cardiologist is the best approach to assess the risks and determine whether the procedure can be safely performed, including considerations for pacemaker function and possible reprogramming if necessary. Option A is incorrect because pacemakers generally don't need to be disabled during fluoroscopy. Option B is relevant to overall patient care but does not address the pacemaker specifically. Option C may be useful but is not the most critical step before proceeding with the procedure. Question 16. The growing trend in cardiovascular interventions has led to a greater emphasis on reducing radiation exposure. What is the most effective method to minimize radiation dose to both the patient and healthcare staff during a cardiac interventional radiography procedure? A. Use the highest possible fluoroscopic settings to ensure optimal image quality. B. Utilize pulsed fluoroscopy at the lowest possible frame rate while ensuring diagnostic quality. C. Allow the patient to remain in the fluoroscopy suite for extended periods to complete the procedure without interruption. D. Rely on direct X-ray imaging without fluoroscopy for all steps of the procedure. Answer. Correct answer B. Explanation. The most effective method for minimizing radiation exposure is to utilize pulse fluoroscopy at the lowest possible frame rate while ensuring that the images maintain diagnostic quality. This reduces the overall radiation dose compared to continuous fluoroscopy. Option A increases radiation exposure unnecessarily. Option C is not an effective strategy for reducing radiation as prolonged exposure increases the dose. Option D is not always feasible as fluoroscopy is essential for visualizing certain aspects of the procedure. Question 17. In the absence of adequate patient sedation during a coronary angiography, a 60-year-old female patient begins to exhibit signs of severe anxiety and discomfort. What is the most appropriate action for the interventional team to take? A. Proceed with the procedure and offer verbal reassurance to the patient throughout. B. Administer additional sedation as prescribed by the physician to ensure the patient's comfort and cooperation. C. Immediately terminate the procedure and refer the patient for an evaluation by psychiatrist. D. Inform the patient that the procedure is nearly complete and encourage them to remain still. Answer. Correct answer B. Explanation. The most appropriate response is to administer additional sedation to ensure that the patient is comfortable and cooperative for the remainder of the procedure. Severe anxiety can cause physiological stress, which could complicate the procedure and affect the patient's well-being. Option A is insufficient, as verbal reassurance may not effectively alleviate severe anxiety. Option C is unnecessary, as the patient's anxiety can be managed with sedation. Option D could potentially worsen the patient's condition and discomfort. Question 18. Given the circumstances of a patient with a history of contrast-induced nephropathy, what is the best practice when selecting and administering contrast media for a cardiac interventional procedure? A. Use a low volume of contrast media and monitor renal function closely before, during, and after the procedure. B. Choose a higher dose of contrast media to ensure adequate imaging quality and reduce procedure time. C. Proceed with the usual contrast dose and monitor the patient's urine output post-procedure. D. Refrain from using any contrast media to avoid potential renal damage. Answer. Correct answer A. Explanation. For patients with a history of contrast-induced nephropathy, the best practice is to use a low volume of contrast media and to closely monitor renal function before, during, and after the procedure. This minimizes the risk of further renal damage. Option B may increase the risk of contrast-induced nephropathy. Option C does not adequately address the patient's history of renal issues. Option D is not appropriate, as contrast media may still be necessary for the procedure, but its use should be carefully managed. Question 19. The relationship between contrast media and the occurrence of anaphylactoid reactions is well documented. A 45-year-old patient undergoing coronary angiography develops a mild rash and itching after contrast administration. What is the most appropriate course of action? A. Administer antihistamines and corticosteroids immediately and proceed with the procedure. B. Monitor the patient's symptoms and continue with the procedure, as mild reactions are typically self-limiting. C. Terminate the procedure and prepare to administer epinephrine, as the reaction could escalate. D. Discontinue the procedure immediately and consult with an allergist before proceeding. Answer. Correct answer A. Explanation. Mild anaphylactoid reactions such as rash and itching can be managed by administering antihistamines and corticosteroids. Close monitoring of the patient is essential, but the procedure can generally continue if the reaction is controlled. Option B is not ideal, as medical intervention is required to manage the reaction. Option C would be excessive unless the symptoms escalate. Option D is unnecessary in the case of a mild reaction if proper management is initiated. Question 20. During a routine equipment check in the interventional radiography suite, a malfunction is detected in the fluoroscopy unit. The imaging system is producing suboptimal quality images. What is the first action the radiologic technologist should take according to safety and quality control protocols? A. Immediately replace the imaging system with a backup and report the malfunction. B. Continue using the faulty fluoroscopy unit while adjusting settings to compensate for the issue. C. Report the malfunction to the appropriate supervisor and schedule maintenance to repair the equipment. D. Attempt to troubleshoot and fix the issue independently before using the equipment again. Answer. Correct answer, C. Explanation. According to quality control protocols, the first action should be to report the malfunction to the appropriate supervisor or maintenance team to schedule repairs. The equipment should not be used if it is producing suboptimal images. Option A, it may not be necessary if the issue can be repaired. Option B, compromises patient safety and image quality. Option D, is not recommended as only qualified personnel should attempt repairs. Question 21. During a coronary artery intervention, a 68-year-old male patient experiences sudden chest pain and a drop in blood pressure, his exosome segment elevation. What is the most appropriate action the healthcare team should take? A. Administer a beta blocker to stabilize the patient's condition and proceed with the procedure. B. Immediately stop the procedure and administer thrombolytics to restore blood flow. C. Continue with the procedure as the patient's symptoms are likely a result of temporary discomfort. D. Stop the procedure and consult a cardiologist for further evaluation of potential acute coronary syndrome ACS. Answer. Correct answer, D. Explanation. The patient's sudden chest pain, drop in blood pressure, and segment elevation are signs of potential acute coronary syndrome ACS. The procedure should be stopped immediately and the cardiologist should be consulted for further evaluation and intervention. Thrombolytics option B might be an option, but they are not appropriate to administer in all cases without further evaluation. Options A and C are not appropriate in the face of these alarming symptoms. Question 22. A patient is undergoing a percutaneous coronary intervention (ECI) and requires a coronary artery stent placement. What is the most critical aspect of the interventional radiographer's role during this procedure? A. Ensuring the patient is properly sedated and that vital signs are closely monitored throughout the procedure. B. Positioning the patient for optimal imaging and ensuring the catheter and guide wire are correctly placed. C. Administering contrast media in appropriate doses and monitoring for allergic reactions. D. Maintaining the sterile field and assisting the physician in the placement of the stent. Answer. Correct answer, B. Explanation. The most critical role of the interventional radiographer is to ensure the proper positioning of the patient and the accurate placement of the catheter and guide wire. This is crucial for the success of the procedure and minimizing complications. While options A and C are important aspects of patient care, the radiographer's primary responsibility is the technical aspect of catheter placement and imaging. Option D refers to sterile techniques, which are essential but secondary to positioning and catheter placement. Question 23. A 55-year-old female patient with a history of hypertension is scheduled for a coronary angiogram. She is on anticoagulant therapy. What should the interventional radiography team be most concerned about before proceeding with the procedure? A. Ensuring the patient's blood pressure is stable and within the normal range for the procedure. B. Ensuring that the patient has been off anticoagulants for at least 24 hours prior to the procedure. C. Confirming that the patient has fasted for at least 8 hours before the procedure. D. Ensuring the patient has been administered prophylactic antibiotic to prevent infection. Answer. Correct answer, B. Explanation. Anticoagulant therapy can increase the risk of bleeding during invasive procedures like a coronary angiogram. The healthcare team must ensure that the patient has been off anticoagulants for the appropriate period before proceeding. Option A is important, but managing anticoagulant therapy is more critical in this scenario. Option C is not as crucial for this procedure, and option D may be relevant depending on patient history, but managing anticoagulants is the priority. Question 24. A 72-year-old male patient with a pacemaker is undergoing a coronary angiography. What is the most important consideration regarding the pacemaker during this procedure? A. The pacemaker needs to be disabled to prevent electromagnetic interference from the fluoroscopy equipment. B. The interventional radiography team should consult with the cardiologist to ensure pacemaker settings are adjusted for the procedure. C. The pacemaker should be programmed to a higher rate to prevent bradycardia during the procedure. D. No special precautions are necessary as fluoroscopy will not affect the pacemaker's function. Answer. Correct answer. B. Explanation. The pacemaker settings may need to be adjusted before the procedure to prevent interference with the coronary angiography. Consulting with the cardiologist is the best approach to ensure that the pacemaker is properly managed during the procedure. Option A is incorrect because pacemakers generally don't need to be disabled but may need to be reprogrammed. Option C is unnecessary unless the patient's condition dictates it. Option D is incorrect because certain precautions are necessary to prevent pacemaker interference. Question 25. During a coronary angioplasty procedure, the interventional radiographer notices that the patient is developing a hematoma at the insertion site. What is the most appropriate action to take? A. Apply pressure to the site immediately to control bleeding and assess the hematoma size. B. Ignore the hematoma as it is. A common side effect of the procedure will resolve on its own. C. Administer a clot-busting agent to dissolve the hematoma and prevent further complications. D. Prepare to stop the procedure and transfer the patient to the emergency department for surgical evaluation. Answer. Correct answer. A. Explanation. The first step in managing a hematoma is to apply pressure to the insertion site to control bleeding. The radiographer should monitor the hematoma's size and alert the physician if the condition worsens, ignoring the hematoma. Option B, or administering clot-busting agents. Option C, are not appropriate responses. Option D would only be necessary if the hematoma becomes severe or there are additional complications. Question 26. After coronary angiogram, a patient is observed to have an abnormal increase in creatinine levels. What is the most likely cause of this finding and what action should be taken? A. Contrast-induced nephropathy due to the use of iodinated contrast agents. The patient should be monitored closely and hydrated. B. An acute allergic reaction to the contrast agent. Antihistamines should be administered immediately. C. A reaction to the stent material used during the procedure. A corticosteroid should be administered to reduce inflammation. D. A result of dehydration and the patient should be given fluids to correct the issue. Answer. Correct answer. A. Explanation. Contrast-induced nephropathy is a known complication of coronary angiograms and other procedures that use iodinated contrast agents. Monitoring kidney function and ensuring the patient is properly hydrated is crucial. Option B refers to allergic reactions which do not typically cause increased creatinine. Option C is not related to creatinine levels. The stent material can cause complications but not increased creatinine. Option D might be relevant, but dehydration alone does not explain the rise in creatinine after contrast administration. Question 27. A patient undergoing coronary angioplasty begins to experience significant chest pain and diaphoresis. The ECG shows elevation in the inferior leads. What is the most appropriate course of action? A. Administer nitroglycerin and continue with the procedure to restore blood flow. B. Stop the procedure immediately. Administer aspirin and prepare for emergency revascularization. C. Continue the procedure as planned, as the symptoms are likely due to anxiety. D. Proceed with the procedure while administering high-dose heparin to prevent clot formation. Answer. Correct answer. B. Explanation. The patient's chest pain, diaphoresis, and elevation suggest acute myocardial infarction, or a serious ischemic event. The procedure should be stopped immediately and emergency revascularization should be prepared. Administering aspirin, option B, is appropriate to prevent further clot formation. Option A is inappropriate because the patient is likely experiencing MI. Option C underestimates the severity of the symptoms. Option D is not enough by itself and does not address the need for immediate intervention. Question 20. In a coronary angiography procedure, a radiologist asks the interventional radiographer to change the fluoroscopic settings to optimize image quality. Which settings should the radiographer adjust to minimize radiation exposure while ensuring adequate imaging? A. Increase the fluoroscopy frame rate to capture more frames per second. B. Decrease the fluoroscopic pulse rate to lower radiation dose and improve patient safety. C. Use continuous fluoroscopy at the highest possible intensity to improve clarity. D. Adjust the collimation to focus on the area of interest and reduce unnecessary radiation. Answer. Correct answer, D. Explanation. Adjusting the collimation is the best approach to minimize radiation exposure while ensuring optimal imaging of the area of interest. This helps focus the beam and reduces unnecessary exposure to surrounding tissues. Option A increases radiation without improving image quality. Option B would lower the frame rate too much, potentially compromising image quality. Option C unnecessarily increases radiation exposure. Question 29. During a coronary angiogram, the interventional radiographer notices that the image quality is suboptimal due to motion artifacts. What is the most appropriate action to take? A. Increase the fluoroscopy dose to enhance image clarity. B. Adjust the patient's positioning to ensure minimal movement and reduce motion artifacts. C. Change to high-resolution imaging setting to improve image quality. D. Proceed with the procedure and accept the image quality as it is. Answer. Correct answer, B. Explanation. Motion artifacts can significantly degrade the quality of fluoroscopic images. The radiographer should adjust the patient's positioning to ensure they remain as still as possible, reducing motion artifacts. Option A increases radiation unnecessarily. Option C may not resolve motion artifacts if the patient is moving. Option D is not acceptable as it could impact the success of the procedure. Question 30. A 65-year-old male patient with diabetes is undergoing a coronary angiography. The interventional team is concerned about the risk of contrast-induced nephropathy. What pre-procedure action should the team take to minimize this risk? A. Ensure the patient is well hydrated with Romanuids before the procedure to flush out the contrast. B. Administer a diuretic to prevent fluid retention during the procedure. C. Discontinue the patient's diabetes medication 24 hours before the procedure. D. Pre-treat the patient with corticosteroid to reduce the risk of nephropathy. Answer. Correct answer, A. Explanation. Ensuring the patient is well hydrated with Romanuids before and after the procedure helps flush the contrast from the kidneys, reducing the risk of contrast-induced nephropathy. Option B would not be appropriate and could exacerbate kidney issues. Option C is not a standard practice and could lead to other complications. Option D is not effective in preventing contrast-induced nephropathy.